This presentation will cover basic electrocardiography. We're going to look at different lead systems, standard EKG paper, and then components of the EKG cycle and the waveforms that are associated with that cycle. An electrocardiogram, or ECG, or EKG, really records electrical voltages that are generated by depolarization of cardiac cells. It measures through the skin with electrodes connected by cables to a machine. It provides information about conduction disturbances, electrical effects of meds, perhaps electrical effects of electrolyte imbalances. It could detect ischemia or myocardial injury. It does not provide any information about contractility of the myocardium. That has to be evaluated through patient assessment, looking at pulse and blood pressure. The ECG electrodes and lead systems are made up of a couple of different components. First of all, there are disposable electrode patches that contain a conductive gel that will conduct skin voltage through lead cables and then display them on the monitor. An EKG lead is a record of current flow between two electrodes, positive and negative. Electrodes and lead wires are applied at specific locations on the chest wall and/or extremities. There are two different styles. There's a 3-lead and a 5-lead. On the 3-lead patient cable, there's a white, a black, and a red. And you can see on the connection points, they're labeled as to where they would go. With the 3-lead electrode positions, you have one that would be on the right arm or right upper extremity, or the right part of the chest. That would be a white cable. Left arm or left upper chest would be the black cable. And then the red electrode would go on the left lower, the lower portion of the chest, outer aspect. A 5-lead patient cable has white, black, red, green, and brown. This is the typical positioning of the 5-lead electrodes. We're added on a green cable which goes on the right lower, and then a grounding cable which goes in the center of the chest. The difference between the two is it would allow the heart to be monitored from various different positionings, and different kinds of electrodes would indicate different kinds of positioning of your waveforms on your tracings. When we consider waveform deflections, the waveform is movement away from the baseline in either a positive upward position or a negative or downward direction. When the depolarization wave is moving toward the positive, the waveform will be positive or upright. So I look at this as we're heading toward the positive, so we're going to be looking up. We're going to have an upright picture on our ECG tracing. When the depolarization wave is moving toward the negative, the ECG form will be negative or inverted. It will go below the baseline. So let's just take a picture to kind of reinforce this knowledge. This is Ivan Thode's triangle, and it's showing you how the leads are placed and why they're placed in certain positions, and which ones are negative and which ones are positive. And this is showing leads 1, 2, and 3 that make up the standard limb leads. In the bipolar leads, the right arm electrode is always negative, and the left leg electrode, or left lower, is always positive. So now the way the machine will read is going to be based on the positioning or how the current is flowing between those two leads. It can only go from point A to point B. So in lead 1, we're looking at the difference in electrical potential between the LA and the RA, so the left arm and the right arm. So it's going directly across the chest, flowing from negative to positive. So it views the lateral wall of the left ventricle, and the lead axis is RA to LA. Therefore, we're traveling toward the positive. We would have an upright deflection. Lead 2 is looking at the difference in electrical potential between the left lower and the right arm, or the right upper chest lead. And this is looking at the inferior surfaces of the left ventricle. Obviously, the left ventricle is the workhorse of the heart, so most of the time we're considering what's going on with that chamber. This lead axis is RA to LL. So when we're looking at that, we're still traveling toward the positive. So things are looking up, and we'll have an upright deflection. Lead 3, again, is recording the difference between the left lower and the left arm. So we're going up and down the left side, and it views the inferior surface of the left ventricle. Going LA to LL, we're traveling toward the positive again, so things are looking up. Again, we're going to have an upward deflection of our ECG tracing. This is the MCL1, or modified chest lead. It's a variation of a precordial lead V1. There's 12 lead EKG class that you could take, and it would show you 12 different leads that you would place on the body. That's beyond the scope of this class. However, occasionally we will have an MCL rhythm strip to look at. And interesting is the negative electrode below the left clavicle, and the positive electrode is right of the sternum in the fourth intercostal space. The main depolarization wave is away from the positive, so we're traveling toward the negative. Therefore, we will have a negative deflection on our ECG tracing below the baseline. Here's a summary slide showing you how each mechanism is traveling and how the machine will be reading the conduction system and reading the travel of the electrical current as it's traveling from point A to point B for each of those lead placements. ECG paper is standardized, and there's two different ways that we're looking at the ECG paper. We can either look at the vertical axis or the horizontal axis. The vertical axis is really a voltage or amplitude measurement. When you look at the ECG paper, it's divided very standardly into small boxes that are contained within larger boxes marked by darker lines on the grid. And as you can see in the slide here, the small box is broken out, and then there's a 5 by 5 box. That's kind of one of our larger squares. It's 5 by 5. So when we're looking at the vertical axis or voltage amplitude, each tiny little box is 1 millimeter by 1 millimeter. The large square then would be 5 millimeter by 5 millimeter, and so on. This is used to depict ST elevation and ST depression. It's a voltage reading, and we will be looking for things to be above or below the baseline. The horizontal axis is a time measurement. These are measured in milliseconds. And again, when you look at the breakout of the box, every small box on the ECG tracing represents 0.04 seconds or 40 milliseconds of time. And a large box, because it's 5 by 5, it's 5 small boxes in a row, it represents 0.20 seconds or 200 milliseconds. This will become important when we start looking at our intervals and measurements of segmentation. ECG paper, it has time markers on it, 1 second, 3 second, and or 6 second. They're like little hash marks. They can appear on the top or the bottom of the ECG tracing. I have them depicted here, as you can see on the upper ECG paper. You can see 0, 1, 2, 3, 4, 5, and 6 represented by those arrows. And then in the bottom ECG paper, there's only 3 markings. So the first one would always be 0, then you would have 3, and then you would have 6. For the purposes of this class, we will always be using standard paper on a 6-second strip. And in our next segment, you'll see why this becomes critically important to understand your time measurement across your ECG tracing. If you have questions on this segment, please post them to the Raise Your Hand forum on our Blackboard site.